When you're a vet uh, working with horses, these magnificent animals, there's always this challenge, isn't there? How do you know if one is getting seriously sick, like with an infection, before you see the really obvious signs?
Absolutely. Especially with young foals. They can go downhill so incredibly fast.
It's scary how quickly. And that's why today we're doing a deep dive into something pretty remarkable, a tool vets are using more and more to get ahead of these problems. Serum Amyloid A, you'll often hear it called SAA.
Right. SAA is becoming, well, almost fundamental for getting that early warning. It really shifts things towards being proactive.
Exactly. So our mission today for you listening is to unpack what SAA actually is, why it's considered, maybe the most significant inflammatory marker in horses, and how it's genuinely changing the game for early detection, diagnosis, and even checking if treatment is working.
It acts like this internal alarm system, really
And,
sensitive.
and get this is pretty amazing. There are now stall side tests for SAA that can be up to, I think the number is 30 times more sensitive than a thermometer at picking up an infection.
30 times.
Yeah.
And you get answers in minutes, not days.
Which, for a sick foal, is just transformative, truly.
Okay, so if SAA is this critical early warning signal, let's break it down. It's a big part of what's called the acute phase response. Can you walk us through that? What's happening in the horse's body?
Sure. So the acute phase response is the body's sort of immediate general reaction to trouble. Could be an injury, an infection, any kind of inflammation, really. Think of it like the body scrambling its first responders.
Okay.
It's this whole cascade of events. And a key part is a really rapid increase in certain proteins in the blood. We call them acute phase proteins, or APPs.
Right, APPs.
And in horses, SA is the standout. It's considered the major APP, the most significant one clinically.
Yeah.
Its levels go up fast and basically mirror how intense that initial inflammation is.
So like a direct gauge of that internal alarm bell ringing. How fast are we talking? How quickly do SAA levels change compared to, say, a healthy horse baseline? Oh, it's dramatic. In a healthy horse, SAA is usually very low, like less than 20 milligrams per liter, often much lower, maybe under zero 0.5 even.
Tiny amounts.
Very low. But if there's inflammation or infection, boom. SAA levels can surge, sometimes more than 100 times that normal level, and often within just 24 hours.
100-fold. Wow.
Yeah. And just as important, it clears out relatively quickly, too. Its half-life in the blood is quite short, maybe 30 to 120 minutes.
Uh-huh.
So the levels go down fast when the inflammation starts resolving. That dynamic nature, up fast, down fast, makes it incredibly useful for tracking what's going on.
That makes sense. That rapid rise and fall must be great for monitoring. But just fundamentally, where does SAA come from? Where is it made in the body?
Primarily, it's made in the liver. SAA is actually a type of protein called an apolipoprotein.
Okay.
When there's inflammation, specific signaling molecules, cytokines, tell the liver cells, hey, we need defenses, and the liver ramps up production of these acute phase proteins, SAA being a key one.
So the liver is the factory.
Pretty much. And SAA isn't just a passive marker. It actually plays a role in the immune response itself. It helps regulate inflammation, tracks immune cells like neutrophils to the site of the problem. It's an active participant.
Interesting. So it's not just reflecting the fire, it's kind of fanning the flames in a controlled way initially?
That's a good way to put it, yeah. It helps mobilize the defense.
Does having really high SAA levels ever become a problem in itself for the horse?
Generally, the high level itself isn't directly harmful in the short term. The big exception, though, is with chronic, long-lasting inflammation.
Ah, okay.
If that inflammation goes on, fragments of SAA can start getting deposited in tissues. This is a condition called amyloidosis.
Amyloidosis.
Yeah, and
Right.
that can cause serious problems. It can affect organs like the liver, kidneys, spleen, leading to organ dysfunction and, in really bad cases, organ failure or even death. But that's usually linked to persistent unresolved inflammation.
A sobering reminder about chronic issues. But let's get back to its power as a diagnostic tool. For vets out in the field, how does SAA actually change how they figure things out, especially when the signs are subtle?
Well, this is where it's a real game changer. SAA levels often shoot up before you see those obvious clinical signs. That early warning is just gold, especially for newborn foals where acting fast can literally save their life.
So it buys you critical time.
Exactly. For example, in foals, we have some useful thresholds. Levels over 50 micrograms per milliliter are considered suspicious for infection.
50. Okay.
And if it goes over 100 micrograms per milliliter, that's highly suggestive of an active infection. It gives vets the confidence to say, okay, we need to investigate further, maybe start treatment much, much sooner.
That's fascinating. You said earlier it's a non-specific marker, but now you're saying it helps differentiate infection from, say, just a bump or bruise. How does it do that if it's not specific to bacteria or a virus?
That's a really key point.
Mm.
It is non-specific. It just signals inflammation is happening somewhere. But the magnitude and speed of the SAA response often differ.
Ah, the pattern matters.
Precisely. A simple physical injury might cause a mild, maybe moderate rise in SAA, but a significant bacterial infection, that typically triggers a much higher, much faster surge, often getting well over that 100 micrograms per milliliter mark.
I see.
So while it doesn't name the bug, that very high level strongly points towards an infectious cause rather than just, sterile inflammation from a knock. And that helps guide the next steps, what tests to run, and crucially, helps avoid giving antibiotics when they aren't needed.
Which is huge for antimicrobial stewardship, right?
Yeah.
Avoiding unnecessary antibiotics.
Absolutely massive. It's a really important side benefit.
Okay, so early detection helps differentiate infectious versus non-infectious. What about tracking how a horse is doing after you started treatment?
Well, monitoring is another major strength. Remember that short half-life we talked about?
Great, it clears quickly.
Because it rises and falls so rapidly in response to the actual information, measuring SAA levels over time doing serial measurements gives you a near real-time picture of how things are going.
Like a progress report from inside the horse.
Exactly. If the treatment's working, you expect to see those SAA levels drop, often quite dramatically. If they stay high, or worse, start climbing again, that's a red flag. It tells you the treatment might not be effective, or maybe there's a complication developing.
So you can adjust the plan much more effectively.
Precisely. It allows for really responsive medicine.
Where else are vets finding SAA useful? What kinds of conditions typically show elevated levels?
Oh, it's used across a really wide range. It's particularly valuable in infectious diseases, like diagnosing sepsis in foals. Septic foals consistently have much higher SAA than healthy ones.
Okay.
It's also used in cases of rhodococcus equine pneumonia in foals, though maybe the link to severity there is a bit less clear-cut sometimes. We see it elevated in joint infections, septic arthritis, also in major gastrointestinal issues like colic or severe diarrhea. Even after surgery, you expect a rise due to the post-op inflammation.
That makes sense. Surgery is a controlled injury, in a way.
Right. And beyond those, it's been shown to rise with things like experimentally induced arthritis, other respiratory diseases, even just the stress of foaling or vaccination, really intense exercise, even transport stress can cause a bump.
Wow, okay, so it really is a broad indicator of stress or inflammation in the body. For vets using this day to day, what are the actual numbers they're looking at, those reference ranges, especially for foals?
Yeah, the numbers are important context. For healthy adult horses, generally you're looking at less than 20 milligrams per liter, often much lower, as we said.
Okay, less than 20 for adults.
For healthy newborn foals, it's a bit different. It starts very low, maybe around 1 milligram per liter on day 1, might bump up slightly on day 2, maybe to around 4, then usually drops back down by day 3.
So there's a little fluctuation normally right after birth.
A little bit, yeah. But the key clinical thresholds for foals, like we touched on, are over 50 micrograms per milliliter warrant suspicion and rechecking. And over 100 micrograms per milliliter is highly suggestive of infection and really helps distinguish it from non-infectious causes.
Got it. 50 for suspicion, 100 for strongly suggesting infection.
Those are the practical numbers vets often work with.
And you mentioned those rapid stall-side tests devices like Stable Lab. How much have they changed things?
Oh, immensely. Having a handheld reader like the Stable Lab EQ1 that gives you a reliable SAA number in about 10 minutes, right there next to the horse, it's revolutionary.
No more waiting days for the lab.
Exactly. For a sick foal, waiting days is just not an option sometimes. Their condition can change so drastically, so quickly. Getting that number immediately, that actionable data, right then and there, it's huge. And like you said, being potentially 30 times more sensitive than just taking a temperature for detecting infection is a massive leap.
That immediacy must make a huge difference in outcomes. Now, for foals, there's another test vets always talk about, IgG testing. That checks maternal antibody transfer rate. How does SAA fit in with IgG? Are they related?
That's a really important distinction to make. They measure completely different things, but they're both vital pieces of the puzzle for foal health.
Okay, different jobs.
Right. IgG testing tells you if the foal got enough protective antibodies from the mare's colostrum. Did it get good passive immunity? It's crucial for knowing its baseline defense level.
But it doesn't say if it's sick right now.
Exactly. IgG tells you about its inherited protection, not about current infection status. SEA, on the other hand, directly measures the current inflammatory response, indicating if there might be an active infection brewing now.
Ah, okay. Past protection versus present problem.
Precisely. So ideally, you use both. Checking IG tells you about their immune foundation, and checking SAA alongside it, perhaps as part of a routine foal check, helps catch infections super early, often before the foal even looks sick. They really complement each other.
That makes perfect sense. Using both gives a much fuller picture. And we touched on this briefly, but let's circle back to antibiotic use. How significantly does SAA help with making responsible choices there? Antimicrobial stewardship is such a critical issue.
It's a massive contributor. We're all incredibly concerned about antimicrobial resistance globally. Using SAA testing judiciously can really help vets decide when antibiotics are truly necessary and when they might be withheld safely.
Gives them confidence to hold off sometimes.
Yes. For instance, studies looking at screening programs for Rhodococcus equa in foals have shown that incorporating SAA testing reduced the overall amount of antibiotic treatment by over 45%,
Wow, nearly half.
nearly half, without negatively affecting foal health outcomes. That's huge. It demonstrates how SAA can provide objective data to guide those critical decisions, minimizing unnecessary antibiotic exposure and helping preserve their effectiveness for when they're genuinely needed. It's a quiet but powerful tool in that fight against resistance.
That's incredibly important work. So let's kind of wrap this up. Bringing it all together, what's the bottom line for horse health? Serum Amyloid A sounds like a genuinely powerful, fast-acting, really valuable tool.
It absolutely is. Its speed, its dynamic nature, and especially the availability of those quick stall-side tests.
Hmm.
It's made a huge difference. It allows for earlier detection, better differentiation of what's going on, and much more precise monitoring of treatment.
And you use it alongside everything else, right?
Oh, definitely. It's crucial to remember it is non-specific. It tells you that there's inflammation, not why. So you always interpret it alongside a thorough clinical exam, the horse's history, other diagnostic tests. But used correctly, it significantly boosts diagnostic accuracy and confidence, especially for those really fragile newborn foals. It enables a proactive approach that just wasn't feasible before.
And is the research still ongoing? Where might SAA investigation go next?
Oh yeah, the research definitely continues. People are looking more closely at SAA patterns in specific conditions like different causes of foal diarrhea and trying to better correlate levels with patient outcomes. And there's always work being done on improving the point-of-care tests, making them even faster, more reliable, maybe even more sensitive. The quest for better, quicker diagnostics never really stops.
Always pushing forward. It's really fascinating stuff. It makes you think, doesn't it? If just one biomarker like SAA that responds so quickly can have such a profound impact on how we care for horses, what other hidden signals might be out there? In horses, maybe even in us humans, that could completely change how we spot and treat diseases down the road. Something for you to ponder.